So let's talk about the study that you published last year that's called "Do Patients with Low Back Pain Remember Physiotherapist's Advice?" So could you just tell us a little bit about that?
Yes, my pleasure. Yeah, we actually, having a lot of clinical experience in the clinic, so with my colleagues and all over the years, so we found that quite regularly we experience that patients come back and you got the idea that they just don't know what you were talking last time about. So maybe let's say they show you the wrong exercises, they give you a strange explanation of whatever, or maybe you see a patient of a colleague. A colleague treated a patient last week maybe, and this week the patient ends up with you, and maybe your colleague gave you some information on this patient and how he behaves or she behaves and what was the exercise. And then you are kind of surprised that the patient tells you another story. So we asked ourselves, do patients really hear what we say? And then we checked the literature about that. So to find out, is there any literature, is there any research on this specific topic? So day one in the clinical setting, in the private practice, how good do patients actually remember or really hear what you say? And we didn't come up with results. We found some research on communication and some on adherence, therapeutic adherence, compliance, all this stuff, but nothing really on this very basic, very starting topic. So what starts on day one. So we didn't find that much on this. So we decided to run a research project on that.
And so tell us a little bit, what are the clinical implications of your findings and how this related to MDT?
Yeah. So first of all, so we asked the question, do patients remember what therapists tell them? And we found, surprisingly, yes, because we had 90 patients in this, it was a mixed method study, so qualitative and quantitative research. So we had 90 patients in this study and so 90 questionnaires and 26 physical therapists working on this. So at the end, we found that the patients we had in the study, they remembered quite well what the therapist told them or gave them, therapeutic advice, information, exercises. So, and we were really wondering how could this be the case, because we expected something different. So our hypothesis was that it might come up with some very mixed results. So we found that they understood what we told them, and so we tried to find out why does communication work in this setting. It was mainly our clinic, but also a hospital in Zurich in Switzerland and 3 other outpatient clinics in Freiburg. But most of the patients say they were treated or evaluated in our clinic. So what we found is patients understand what we tell them or hear what we tell them if we check for 4 different things, or if we are aware of 4 different aspects. So first of all, there should be shared decision-making in the therapeutic process already. So in the diagnostic process. So usually shared decision-making plays an important role when it comes to therapy. So together with the patient, we might decide which medication to take, or maybe how many times he can do the exercise during the day or whatever. But in our study, we found that the patients, they really appreciated to be involved in the diagnostic process. So that was number 1, shared decision making. And number 2 was the exercises. The exercises should be simple, and there should be only a few exercises. So we found that if you are using more than 2 exercises or 2 information, the risk that the patient does not remember what you tell them, or him or her, is very high. So maybe only 1 or 2 exercises, shared decision making. And then we found that it's very important to ask for expectations, which is not new. We know that from the literature, and that we should approach worries about back pain. So that was, and nevertheless also it should be an active evaluation. So the patients, we did interviews with 14 patients, and the patients really appreciated to have an active evaluation. So make them move, and so, yeah.
And what is interesting, that McKenzie has all of these components on the education process. So I was just
Absolutely.
wondering that probably the same study wouldn't have the same results with other techniques that don't use the same way of approaching that, because usually we give 1 or 2 exercises. But traditional physical therapy, sometimes the patients, they leave the clinic overwhelmed with a list of exercises, which makes harder for them to comply with the exercises. And also Mackenzie is very active, opposed to passive. So I just think it's so interesting, these results, that is a little surprising that they really understand and remember all the instructions. But also, I think the educational component of the method is super strong. So I'm not actually surprised with the result.